Council meeting. I'm Chris Goff, and I serve as chair of Indiana State JRAC. Thank you to everyone joining us today, both in person and virtually. As a reminder, we will be conducting roll call votes for each action item today, as we do have members joining us remotely. The first item of business for today's meeting is the approval of the proposed minutes of our April 17th, 2026 meeting. Members were provided copies of the proposed minutes in advance of today's meeting. If you've had an opportunity to review them and there are no questions, concerns, or corrections, I would entertain a motion to approve the minutes.
So moved.
Thank you, Doug. There is a motion to approve. Is there a second? Second. Thank you, Judge Spitzer. There is a motion to approve and the second the proposed minutes from April 17th. Any further discussion? Need to call for a roll. So, Sheriff Balin, you're joining us remotely. Did you approve the proposed minutes, sir?
I do.
Thank you. Danny?
Yes.
Steve?
Yes.
Doug?
Yes.
Chris?
Yes.
Angela?
Yes.
Courtney?
Yes.
David?
Yes.
Sarah?
Yes.
Chris?
Yes.
Ashley?
Yes.
Judge?
Yes.
Senator?
Yes.
Thank you. The proposed minutes will stand approved as presented. The next item of business is report outs from our JRAC work groups. And the first report out relates to our local JRAC work group. So I'll turn that presentation over to Christine. Good morning, Chris.
Good morning. As previously reported, the JRAC survey was due March 31st. We've extended it a little bit this year so that local JRACs had an opportunity to actually meet before submitting. We are close to 70 submissions now. The dominant theme is just funding, which I know we will talk about a little bit today. They are also expressing a lot of need, sort of mixed progress around data and systems. Problem-solving reports remain high. They obviously, the counties like them. However, they are struggling with some of where the funding will affect their fidelity and being able to maintain and sustain the problem-solving reports. Strong growth around the pretrial expansion, behavioral health integration. We actually received quite a bit of reports of sort of robust CCBHC coordination efforts. Many formal partnerships in place. Persistent gap reported were insufficient local treatment capacity and accessibility. Things like wait lists, costs, and transportation. So collaboration, most local JRACs continue to report good to excellent cooperation. And we're still getting a lot of requests around technical assistance, which is a good thing. CPP continues to engage with the local JRACs. Denise is on. She can talk a little bit more about that. But we continue to receive interest in sequential intercept mapping, system mapping, and the various levels of technical assistance. And I'll leave it to Denise. We lost Denise, so I won't kick it to Denise right now.
Yeah, we lost Denise, so anybody who might be watching, Denise is back. Denise and her team provide technical assistance to our county JRACs, and so I guess we'll ask her for comment if she rejoins. But beyond that, does anyone have any questions for Chris regarding the work of the local JRAC work group? Reports, technical assistance, funding.
I have a question.
Please, yes.
On the treatment capacity, is that just a general question about treatment access, or do we get into specifics of what kind of?
We do not get into specifics. Just there's open boxes, some text boxes there where they can expand on it, but we don't get a lot of that. Okay. Which happy to include that for this next survey with your assistance. We can ask more direct questions about what.
Yeah, mental health or SUD.
Exactly. Yeah.
So Denise, I know you joined us. We might have lost you for just a minute. And before you dropped off, though, Chris was going to ask if you had anything else to offer regarding report out from the local JRAC work group.
So, good morning, Justice Goff. I'm having a little bit of a hard time.
Okay. Yeah,
I'm getting some feedback. So
Yeah,
I apologize.
No, not at all. Chris,
So
maybe
I'll
if you
just
could
say no. I don't have anything else to add, just to avoid this feedback I'm having. Sorry.
You know, I am grateful that Sarah Sailors is here and able to join us for I think the majority of our time today is going to be spent kind of rolling out and having a discussion about our legislative work group. But this discussion about sort of the status and really the funding crisis of our local JRACs is really going to be something I think is front and center in those discussions about the competency restoration issue, because what we want to be able to do if we're going to be directing fewer people into that process is to connect them to treatment at the local level. And we've always had pretty disparate, pretty varied funding streams that have come through DOC and JRAC courts. A lot of those streams are drying up, and they're drying up fast. So the programs, the local programs that have been able to make those connections have included, I want to say primarily our problem-solving courts and programs like this. So as they go away, the ability of our local judicial officers to make those connections, our probation departments to do more with fewer people, because a lot of those departments are funded with these grants, are going to be severely restricted, and that will exacerbate the problem. So I really view that our biggest issue is going to be being able to sustain our local capacity for those people that don't need to be institutionalized. So I look forward to that discussion. I just wanted to put that on the executive branch's radar, that's something that we're all concerned about. Are there any other questions for Chris or Denise? Probably ought to rely on Chris. We'll get the technical difficulties. Well, thank you, Chris. Next up is a report out from our communications work group. So, Michelle, good morning.
Good morning, sir. Thank you. The communications work group just met yesterday, so this is a fresh update. Their first task was to review the compilation of feedback we had received from prior work group meetings and also from prior local JRAC work group meetings to make sure our list was good about what areas we need to focus on, how we can help improve communication and education of the local JRACs and their membership. At the conclusion of the meeting, we divided up into some focus areas. So we have a small group that's going to focus on the education for orientation onboarding type opportunities. We have a second area where we're going to work with Jenny Bowers, our web editor, for the JRAC page to make improvements on the website and make updates. And then the other area, we have working with subject matter experts on any kind of substantive education that might need to be promoted or delivered as a partnership. And so we did identify that we would work on an education session webinar related to how to use the opioid settlement funds in partnership with ICJI for later this year. So we're working with their representative on the work group and our education team to try to build that and make that available later on. So those are the focus areas we're looking at now. The other request of the work group was if there are opportunities where we can communicate out via newsletters or other ways that we want to get information out to stakeholder groups or to local JRACs, if we can get that material in and get that then distributed timely to those groups so folks can further share education opportunities, those types of things system stakeholders need to be aware of, and happy to help facilitate. That would be our report, sir.
Yeah, I want to thank Michelle and really all the members for your willingness to share some of your CIO's time. Our meeting yesterday was more sparsely attended than we'd hoped, but we think that this is really going to be an important work group because this is a group that's created by statute in every county, and its purpose is not really self-evident. So we had a community corrections director from Grant County, Chris Cunningham, was in that last local JRAC work group meeting, and he said, you know, the local stakeholders, they don't want to be told what to do from Indianapolis, but they kind of want to be told what to do in terms of how to use that group. And I thought that was really important. So, you know, Michelle asked for, and she means it, if you have anything that you think would be of benefit to the group, please make sure that it gets to her, because we're going to change it. We're going to translate it into a language that your members can better understand. And other thing that came up with respect to this discussion, Chris isn't here, but he's got Courtney here. Chris had a really good idea, and David, I think, was you know, supportive of some of the things we might be able to do with it. That we really need to have an orientation program, a dedicated orientation program, because you know our prosecutors, a lot of our stakeholder groups are really shorthanded. It's another kind of effect of the funding crisis, and they don't have a lot of extra time. So if we can bring them up to speed on the value of engagement, it really does help on the other end, right? I mean, it takes some of the workload away if they know how to connect people and resolve cases to some of the things that are here to offer. So really, if you've got the opportunity to do it, please encourage your PIOs to continue to come. And if they can't come, make sure that we get what it is that you'd like the larger group to be aware of, because we want to help you help them understand the value of this work and how powerful they can be if they work together. Beyond that, are there any questions for Michelle? All right. Well, thank you, Michelle, for the update. I'm going to next turn the floor over to Angie Hensley, who will provide us an update on the work of the data work group.
Thank you, Justice Goff. The data work group last met on June 5th. We are working on a self-help guide for local JRACs to use their data to inform local decisions. This was a concern that was identified, I think, a lot in the JRAC survey previously. So the committee agreed on a top 5 to start with, top 5 data points, which include jail data, community supervision, DOC commitment, support data, and behavioral health data and availability. So once those are completed, the data work group will identify the next set of data points to address, to try to see if we can help counties start gathering that information and using it to make those decisions, and who should be bringing that to the table. So also, we are working on a data, so Brendan O'Connor and Oliver Stratton from OJA are working on a data networking map, and hope to be able to show a demo at the August meeting, but we will see how that plays out. It's very interesting to see what you can do with technology. It's like when he's showed a little bit of it, it's interesting to look at. So I'm excited for that. And then Denise actually had helped with the strategic plan and updating it as these things come along and making sure that we have everything included in there. So I appreciated that. I wanted to include that. Our next meeting is scheduled for August 13th, and we'll be reviewing what we have so far on the top 5 data points that we're trying to get out this time.
Angie, that's great. I wondered, we talked just a little bit about this in the pre-meeting, and as you've got those sort of priority points listed, is there work being done on maybe presenting those through a dashboard or something like that?
Yes, but it depends on the where the data is coming from. So first thing we're doing is trying to identify on a lot of those where that's coming from. But then the other one, the data networking, is kind of like a dashboard where you look at it, you click on things that you can filter, you know, those kind of things. So it'll be a tool that people can use. But for the other part, we do have a lot of things on there about different dashboards, and we're trying to identify what would be good. We don't want to present data on a dashboard that could be misconstrued. So we want to make sure it's very, it means what it says it means. So we are looking at those as well. That's on our strategic plan. There are several things that talk about dashboards on there as well.
Okay, great. Any questions for Angie regarding the data?
Can you repeat those 5 again?
Yes, they are jail data, community supervision, DOC commitments, court data, and behavioral health.
And when you guys put that out to the local JRACs, it'll explain underneath kind of what you mean by.
Yeah.
Okay.
So the way we're just trying to identify it first and then we have like some underneath points. Lisa Thompson and her are helping with that as well, as far as like where does the data come from, where would you get it, who would present it, what does it mean when you get it, so we've just started on that, and it would have, I think our vision is kind of looking at kind of the pre-trial model of that performance measure, just where it has some explanations of what it is, an example of how you would use it. So
I think it'll be really helpful when it comes out.
I guess what I envision with this too is sort of that discussion about funding. I think of that, and I think if it's able to sort of accurately paint a picture of what all these different stakeholders are dealing with, it can show DOC at capacity. It could show that X jail at capacity. This is the sort of caseload that whatever criminal courts are dealing with in a particular county. Maybe the local issues with respect to connection to treatment and DMHA numbers with respect to bed space. Having that accessible on a dashboard that we can all share, I think would be very useful in our ability to communicate with each other and our constituents. And I also think, frankly, it might be more helpful in this minute in our discussions with our partners in the General Assembly, because in past we've talked about recidivism, all these things. I think they're really important, but I also think now maybe the issue is more severe if we're trying to deal with immediate need. What's the immediate response? And so if you all have different thoughts, if you all have different points that you'd like the group to focus on, I would welcome that discussion. But just sort of what I'm seeing in conversations with various stakeholders and trying to put out fires, seem to be putting out more fires now than anything else. And so that sounds to me like it's tracking with probably what we need to be looking at. Does anybody else have any different thoughts on that, or does that sound about right?
I agree. We agree from Popeye's standpoint. I know we had talked with ICAC some about maybe presenting a different message to the General Assembly, and the message would be more on how is cutting the problem solving courts, like what will that do to your local community, or what could it do to your local community? Not a bigger picture, but more of a streamlined picture of what's happening now.
Well, and that's something I think we're thinking. I was telling Jenny here, sometimes been so many meetings the last month or so, I forget who was in that meeting with me. But one of the things we'd asked our local judges about a month ago was they got notice. A lot of them are going to receive some funding cuts with respect to DOC grants, and what does that look like in terms of your need to place more people? And it would be pretty severe. And so that's had an opportunity to share some of those concerns with Chris and with the DOC commissioner, and I think they're concerned too. So we're trying to address that as best we can, but it is almost like shuffling things from one place to the other unless you have sustainable funding. The numbers that we've always had, though, Judge Spitzer, if you had some numbers that, with respect, you're always good with incarceration costs or daily incarceration costs, but
just look at it, $85.44 a day per diem.
So I mean,
about $32,000 a year to
put somebody in
DOC. Yeah.
So that was the thought, though, is a lot of these local programs we know can be run effectively, and they can certainly be run much less expensively than if you were institutionalizing someone. So certainly you want to have space for dangerous folks, no question, but I'm just a little concerned about our ability to go through any kind of a transition or deal with just everybody else as these really important programs go away. Anybody else?
I think the other thing I would say, and this is probably something that Chris could or Liz could answer better, is that that's the DOC per diem, but at what point do you get where you need to open a new facility or bring something else on, and then that bumps up your total costs as well too. So I think $85.44 might be like, sort of a minimum cost for that, because certainly there's going to be a point where it's going to become much more expensive. I think is that a fair assumption, Chris?
Well, we're running out of beds. So.
Yeah. So yeah.
Well, with respect to the data points, though, does that seem to track with what you'd be interested in knowing, Chris and Liz?
Yeah, I think so. Yeah.
Doug, are we missing anything from CJI's perspective? Okay, thank you. Okay, all right. I appreciate the update, Angie. Next, we'll hear again from Michelle Goodman for a report out from our reports work group. Michelle.
Thank you, sir. I have 2 items to report to the group today. The first one is on electronic monitoring reports. Our first quarter reports are being compiled. Thanks to all the locals who are getting those in. I would request that if we can work on being a little bit more timely on some of those, that would be helping our team get you materials faster. We will be launching second quarter reports next week and the week after, because second quarter ends on Tuesday. So please look for those emails coming from myself and my team. The second item is regarding the judicial lit report that's required by statute. The draft report was submitted to you in the meeting materials for today. The statute requires us to report on calendar year, but revenues and expenditures for those who have the lit adopted and in place. The report includes 2 counties, Floyd County, which was covered under the original terms of the statute, and Henry County, which is under the modified version of the statute. So Floyd County is grandfathered into their approach to the lit. Henry County has the new limitations. The report you have is the material information those counties submitted to us. It's for JRAC's approval. Once it is approved, then it would be sent to Legislative Council.
So that's an action item.
Yes, sir.
Before we vote, everybody should have received the report from Michelle. Are there any questions for her before we vote on approval of the report? Seeing none. Sheriff Ballin, if I can start with you again, sir. Do you vote to approve the report as circulated?
Aye.
Danny?
Yes.
Steve?
Aye.
Zoe?
Aye.
Doug?
Aye.
Chris?
Yes.
Angela?
Yes.
Courtney?
Yes.
Dave?
Yes.
Sarah?
Yes.
Chris?
Yes.
Ashley?
Yes.
Judge?
Yes.
And Senator?
Yes, sir.
Okay. Very well, thank you. The report will stand approved and as presented. Okay. Anything else then, Michelle, before we get into the next item?
I don't, sir. Thank you.
All right. Well, the big item on the agenda today for consideration, we're also going to hear a report from DOC on their grants. But the item I want to make sure that we are able to present clearly today, to get any feedback from members, is a discussion of our legislative work group. So at our April meeting, this council approved the creation of the legislative work group. And the first task of the work group is to address the issue of competency. Since then, JRAC has engaged the Lifeman Group, a national consulting firm with deep expertise in competency and justice system reform, to help guide this work. And as an initial step, the Lifeman Group will conduct one-on-one stakeholder interviews on July 7th and 8th. They will be conducting virtual interviews with those who are unavailable on the selected dates. These interviews will inform the structure and focus of the broader legislative work group meetings that will follow. Members of the work group will be receiving a calendar invite from Riley within the next week for one-on-one interviews based on your reported availability. If you were not present at the last meeting, or if you missed the communication and would like to participate in this work group, please reach out to Riley. And I will say that all individuals who have volunteered to participate in the work group will be invited to 2 in-person meetings scheduled for August 26th and September 16th. And those meetings are from 10 a.m. to 3 p.m. Beyond that, I would just say stay tuned. for further information from court services in advance of those dates.
One important addition, we will serve lunch. So if that helps you, block out your calendar.
Well done.
It's always important.
Oh, please, yeah, Brittany.
I was just going to add that the legislative worker secured a co-chair recently, if you'd like to talk about that.
Yeah, so we put in this in discussion. Sarah Saylor, our DMH director, has volunteered to co-chair the work group. I'm going to be the other co-chair, and we really look forward to this. A lot of you have been engaged in these discussions for some time. Remember thinking back 7 years ago, Senator, when we took a trip to Deadwood, Colorado, we started looking at this sort of issue of behavioral health in the criminal justice system in earnest. Doug joined us, and it was a good discussion. And at least from my standpoint, one of the things that we always were missing was capacity, something else to connect people to, and maybe the stars are aligned to really address some of those capacity issues. I think there's going to be productive discussions, and really look forward to hearing from everyone and seeing what's next and seeing what we can do to better serve people of our state. Brittany and Chris have really spent a lot of time planning this out. We're on a compressed time schedule with the Lifeman Group. But if any of you have any questions in advance of the process starting, feel free to ask now, or feel free to reach out after the meeting because we want to make sure that we hear from everyone and get everyone's perspective.
Justice, what's the number on the list today? How many are in the line?
Yeah, do you have that?
Sarah, you mean how many people are waiting?
Right,
for
what's that number?
competency restoration?
Right.
Oh, I can get it.
Yeah.
Give me a minute.
Has Rep. Sturwald reached out to you? Have you talked to him, Justice, as well? I know we've had some conversations offline about this topic.
No, but Representative McNamara has reached out and asked that he be included, and so I believe we did extend an invitation to him.
Okay, good, thank you.
It's my expectation, I hope, that he will join us. He's welcome to any conversation we have about this, in my estimation, but not yet. I'd like to. And I welcome any of your partners, quite frankly. That was my indication to our staff, was that if there's a legislator that wants to be part of this, we want to make sure we find the table for them. I really view this as kind of a structure of government discussion. And it's complex.
And we need our sheriff in there as well, up there, Jeff, I see in the corner.
So Sheriff Ballin, we welcome, and we need ISA's participation for sure.
Yeah, absolutely. Absolutely. Thank you.
Anything else, folks? Well, I am just going to go ahead then, and before we get to our DOC presentation, ask for an update from Brittany regarding her office, the Office of Behavioral Health. So, Brittany, what else would you like to share with the group today?
Justice Goff, hi everyone. As a reminder, the Office of Behavioral Health was created in May of 2024, so we just hit the 2-year mark of the existence of the Office of Behavioral Health in the OJA structure. The office prioritizes the behavioral health related needs of Indiana courts and the litigants that they serve. It's really designed to make sure that our courts and our justice system has the tools that they need to recognize and respond appropriately to behavioral health conditions in the courts. We are nearing the end of the fiscal year, so I thought this could be a good opportunity to give you some tentative numbers of what this past year, the second year of the office, have looked like. So some of the core functions of the Office of Behavioral Health is to serve as a resource to judges. So I've received over 200 judicial consults just in year 2, which is a 138% increase from year 1. I think that what that shows us is that judges are, first of all, awareness of the office is growing, and also that judges and judicial officers are being encouraged to think about behavioral elements from the bench. Similarly, I provide the same kind of support to our Office of Judicial Administration and have received over 150 internal OJA consults so that we can really make sure that we're permeating best practice responses around behavioral health as an organization. Another core function of the office is to provide education. Many of you have invited me to present to your organization, so thank you for that opportunity. In year 2, and year 2 is not even over yet, so this is even a tentative number at this point, but I provided 39 presentations reaching over 3,000, almost 4,000 audience members. And that's judges, but it's also treatment providers and sheriffs around the intersection of behavioral health and the justice system. There's a couple of programmatic initiatives that I've talked to you all about before that I want to provide brief updates on. The first and probably most exciting is the Behavioral Health Committee's inaugural report and recommendations. We sent that around via email. If you haven't gotten a chance to take a look at that, the Behavioral Health Committee was created at the same time that the office was created. It's 15 judges who raised their hand and said, you want to be a part of finding solutions here. And they have published their inaugural report. The work groups consisted of education, connection to treatment, competency, and data and funding. So I hope that sounds familiar and similar to a lot of the discussions we're having here today. So take a look at that to see what those judges came up with. We also launched the Honorable Michael J. Kramer ART Program Initiative, and we are supporting 10 counties that are working to stand up ART programs around the state. Again, many of you have been involved in that, and we will be wrapping up the first year of that initiative in October, and working to create a toolkit to bring on additional counties that want to stand up AOT programs. The third initiative I wanted to tell you about was peer-led court-based navigation. RTI received a grant from the National Institute of Health to study the effectiveness of peer-led court-based navigation, where you put a person with lived experience in a courthouse available to broker resources to those coming through the system. And we will be launching in St. Joseph County in August and really studying what does putting a person with lived experience right in the heart of a courthouse do for things like recidivism and overdose deaths. So more to come on that. And my last comment is just that the Office of Behavioral Health is a resource to all of you, all of your organizations. I'm happy to go out and talk to local JRACs. As a matter of fact, Chris and I were just in Madison County yesterday to really think about behavioral health and how it overlays with the justice system.
Brittany, thank you. Talk to you about every week, and I'm always learning something more every time you share with me. We have a non-unified court system that's very disparately financed because a whole bunch of the money that goes into these, most of the money that funds these systems is county-based money. And so some counties that are well-resourced have much less. And the value, in my view, the most important value that we get from Brittany is her ability to go in and familiarize herself with all of those local operations and connect people to whatever is there. And she also then is uniquely equipped to indicate what a particular county-based system might be missing that they need to be connected to. And so that's also part of our competency discussion. We have some places have one judge and very limited supervision staff, and so default to competency before anything else. It's not going to be real obvious. You're going to have a lot of treatment options. So, in my view, Brittany's office is critically important, and that might be a really key missing link as we have these discussions. She might be able to put her in a position to sort of navigate those hard-to-solve cases and find the best possible alternative when somebody presents, especially in those communities that are very limited resources they have available. So we're very thankful to her and her team for the work that they've been doing. Anyone have any questions for Brittany? Well, Brittany, thank you. Keep up the good work. We're going to be busy in the next several weeks.
Thank you.
I'm going to turn the floor over then to our partners from the Department of Corrections. So we have joined us today, Chris and Liz, and I'm going to make us a presentation regarding the 2027 IDOC grants. Good morning.
Okay. Good morning. Thank you. So I'm going to turn it over to Liz because she's going to go through the two documents, but you should have two documents. One that talks about the actual grant awards by counties, and then the other one is the summary. And she's literally probably just going to go through the summary. So
Where we're going to start.
yeah,
Yes.
go ahead.
So if you're looking at the summary document, I just want to kind of walk through some of the information on there with you today. So at the top of the document, you will see the calendar year 2026 award, so what was awarded for the current year, and then the calendar year 27 requests, and then what we were able to award for calendar year 2027. So the department is continuing to prioritize funding programs that provide the most felony diversions to the department. We have less to work with this year, so that was a decision that we had to make. For calendar year 2027, we are going to be able to fund again community corrections, some court programs, and probation programs, totaling $52.9 million. On the middle of the page, under the section that says recommendation strategy, this just outlines the different factors that are considered when we're determining funding awards. So we wanted to make sure that we are providing that information to you. In addition to that, on the bottom left, there is a short description of the funding formula that's in our administrative code that we are currently following. We also utilize that as a guide when we are making the grant funding decisions. And then last but not least, over to the right, there's a little box that just kind of shows like how the budget is set up based on our appropriation. So I just want to point that out. And then you should have also received, as Chris mentioned, there was another document that gives the more details. So if you want to see funding, it shows both by county overall, and then it breaks it down by entity. I feel like I'm talking about a ghost when I say entity, but I'm really not. What type of program it is? Say that. So next steps, we plan to send out official notifications on Monday to the grantees regarding the calendar 27 grant awards. The grantees will then have until July 27th to revise budgets and get those budgets back to us. And then the division will begin the grant contract process. Try to get all of that taken care of by December. Yes, that's where we're at.
Thank you both, and this item of great concern, I know, to a lot of members. So, if there are any questions for Liz or Chris regarding the report?
I've got Liz. Talk about some priorities with regards to diversion from DOC, and so I was wondering. I know we did not have funding for our and the award for our reentry court.
Mm-hmm.
Our reentry court, the population of our reentry court are people that would be at DOC, and so, you know, if we don't have a reentry court, then those people will just stay at DOC.
Right.
So I'm wondering why a similar consideration wasn't given for reentry courts as diversion. In essence, reentry court is a form of diversion, and you know, it would seem that.
Are you talking like just specific to your county? I mean, because we did.
I mean, I'm not familiar with how every reentry
Okay.
court works, so I don't want to, you know, but I know that ours did not, and I know that that's how. I mean, I modified people out of DOC to go into reentry court.
I know. It's also, we also have to keep in mind that funding formula, and there were many counties that are currently overfunded according to that formula that's in our administrative code. So I don't know officially. I can look at it in more detail and get back with you. But my guess is that it has to do with that.
Okay. Yeah. Yeah, I mean, it seems to me to be maybe penny wise and pound foolish from that standpoint, because if we're leaving all those people in DOC, then you're going to pay for them in a different way.
Yes.
Yeah. Any any other questions.
Yeah,
Ashley.
I'll just follow up. I think, at least from my standpoint from the association, echoing what Judge is saying, I know that the problem solving courts did take a large hit out of the funding. And problem solving courts can range anywhere from a mental health court to a drug court to a reentry court. I I guess one of the questions from our association and from several other counties is in those courts, because there were some that were eliminated completely, some that were not. With the funding formula, that doesn't take into consideration problem solving courts. So I guess we're trying to figure out, and maybe correct me if I'm wrong, Judge, with that diversion piece being a high part, and those people in those problem solving courts being the higher level of diversions, how is that taken into consideration as a whole? Because it doesn't seem like there's a lot of consistency with specific courts. For instance, like last year, the pretrial across the board or the jail treatment across the board was eliminated. So I guess it just feels like there's that mixed message of prioritizing the diversions from the commitment to DOC, but then maybe it not looking as if the problem solving courts really got a full scope of that because of all the different types of courts underneath. So was there any additional, I guess, in the cuts, in the recommendations, were there any additional considerations specifically with the problem solving courts as a whole? I guess I'm not quite sure how to answer that. Like were we looking at them individually? Not necessarily.
Okay, so it was county based.
It was, so the formula is county based, so we are looking at that. But we're looking at all of these other things that are outlined in the middle of that document that you have, in addition to that. So it could also, have to do with number of clients served. There are some courts that are really not serving that many individuals on a monthly basis. So we were trying to prioritize, the ones that are, heavily utilized. But in some scenarios, I think similar to what Judge Spitzer was referring to, where it is a great program and they are fully utilizing it, we still weren't able to fund everything.
Liz and Chris are in a tough situation here. It's not like they've made the decision, we're not giving you the money. They're trying to do the best with what they've been given by the General Assembly. And so there's a sense where you guys are catching strays here with this. And so I don't want my comments to mean, that we're cheesed off at DOC. It's,
we appreciate that. Thank you.
It's tough. We're trying to keep our programs going, and it's really tough. And so, and I'm sure our General Assembly partners here are listening as we talk. But if I look at, for example, there's an 18% reduction from the 26 awards, if my math is correct, to the 27 awards, which the 26 awards did not fully address the needs and there was cuts there previously. So, and then the request was $8 million and what was given was 52. So you're $30-ish million shortfall. And so with my math, even from looking at 26 to 27, just 362 inmates, looking at the per diem, that go back to the DOC, you're spending that money anyway. So, and that's just a 1.3% increase in the number of, if I'm looking at the population report. Is it conceivable that it's going to be more than 1%, 0.3% increase that we're going to send back to you because we can't do these? I think the number is going to be way bigger than that. I mean, I do. And I might be wrong about that, but just based on where we stand and the number of people that we sent to DOC prior to criminal justice reform, and then the number we send now, which I think we sent 27 last year or something like that. I was looking at it, and we were sending 100 and some annually before criminal justice reform. So, we dove into criminal justice reform. We were handling people locally. We're doing programming locally. Worked out well in terms of recidivism for us too. And yet it seems like we're going backwards. And again, not y'all's fault. It's not, you guys didn't make the decision to underfund. But the decision has been made to underfund. And so, if the policy decision by the state of Indiana is we want more people to go to prison, okay. And I don't make those policy decisions. I stay in my lane. But what we're asking is give us the resources. Whatever the policy decision you make, we need the resources to address that policy decision. Bad government is we're going a different direction and you don't get the resources to go. And so that's, I guess, the concern that I have, and I don't know that the message is necessarily being received by the people that are making the funding decisions. So, okay. Off soapbox. Hopped off soapbox.
If I could just follow up on that, I mean, I think what we're looking, not that I'm going to aim at you all, but what we're looking for is a more dynamic set of data so that we can go back to the General Assembly and say, if your intention was to save taxpayers money, maybe it didn't really work. It maybe saved money out of this pocket, but this pocket ended up paying more over here. And so I don't know, with all the great work Michelle does on data, and I don't know how. I mean, I don't know how we want to do that dynamic report. I think that's what's important to show the General Assembly save money. Like I say, save money out of this pocket, but we ended up paying more out over here. So it wasn't really a taxpayer savings. I think is what we're trying to get at.
Yeah, and I think for me, I wanted to make sure that our members understood that there is a larger scope here, right? So that it's a funding formula for a county as a whole for all these entities. As you said, Liz, that word entity seems miscellaneous, but it's per program and all of these different levels. And each program does something different and has a different purpose and a different impact. But collectively, from the county as a whole, those then impact the state at such a vast range of ways. And I hope that we're able to see that in these, and I think that's one of the things from the judges, the core programs that we have been so adamant about and so result driven about, those outcomes have really made a difference, not just locally but at the state level, because those are the offenders that have those higher level, longer stay sentences that are impacting that per diem and that bottom line. And it's trying to find that balance, but understanding that all of these entities work collaboratively together, because that is what we have been attempting to do across the last 10, 15 years. So when one or two of them are removed completely, or pieces of them start to get, unfunded, it really impacts the whole system in that county. And that county then has to react in a way that will ultimately cause a significant amount more in expenditures from our state than I think they initially intended.
I'm sorry, just to illustrate. So had two people come into my drug court on Wednesday. One guy had 3 cause numbers, the other guy had 5 cause numbers. Those guys are going to DOC if they're not going to problem-solving courts. These are, high-risk, high-need people, and they're probably going to go to DOC for a while, with 5 felony cause numbers. What we've said is we understand what's driving your criminal behavior, it's your substance dependency. We're willing to handle that locally. You're going to come see me every week while you're in your first days. You're going to get intensive supervision. You're going to treatment multiple times a week. We're going to drug test the crap out of you. We're going to come and look at your house. We're going to be all up in your business, so you don't have to go to DOC. What we know is that usually works. I mean, people, if they successfully get through our program, we don't see them again. And so if we send them to DOC, we do see them again, because they've lost their house, they've lost their kids, they've lost their job, and then they're plugged back in. If we don't have a reentry court to help them get their house kids job back, then they're just going to do what they're going to do. And we've given them a lot of time at DOC to learn how to be better criminals and hang out with bad decision makers too. And does that work for every person in the system? No, it doesn't. But we're evaluating and assessing them and saying this cohort of people we can handle locally, and we're likely to have a better result in terms of recidivism if we address it that way. And so, it makes sense for us to have that option. And if you take options off the table, then everything looks like a nail. You got a hammer, and you're gonna hammer it down.
And to add on to that, you were talking about proper homes, kids, and jobs. Like at the successful completion of a problem-solving court, then they're paying taxes, paying child support, have a job. So that those are
The kids aren't in foster care.
right.
They're,
And that's really hard to quantify, but it's an impact on the counties and number of communities.
So, Judge, you said earlier you acknowledge that they're the messengers, basically.
Yeah.
And I was
Thank you.
telling Liz that I was like, you got this. Like, this is a tough meeting.
They've
And
been such good partners in this whole
Yes.
thing. So I want to,
we get that. And so, Ashley's talking and you're talking, and because we're directly impacted by these numbers and these decisions.
Absolutely.
But what you say is they were given the funding amount to distribute. So I guess what's the recommendation to get these stories to the legislation for those decision makers to hear how it just didn't make sense. This cut didn't make sense for what they were wanting to do.
So, good discussion today, and I'm grateful for the opportunity to have it, and I'm grateful that my friend Senator Clark is present today. Somebody who's former president of the Indiana Sheriff's Association, who ran a jail through a jail building process, and was in a county that really pioneered some of these efforts with respect to evidence-based practices. I view this as a four-alarm fire, and I'm grateful again also to DOC, because my understanding is that this has just been an increasingly shrinking bucket of funds that they've been asked to dole out in a way that allows them to preserve their scarce public safety resources for the most dangerous people, which is what they should be doing. But what is going to happen now, unless we figure out a different pool of money to continue many of these services, is there will be a whole bunch of people going to go to prison, but the prison's at capacity, and so there will be overcrowding in the county jails. There will be nobody to supervise the people that there's no room for in the jails, and it's going to hurt public safety terribly. And so standing up that PIO work group is incredibly important, because if your constituency believes this and they're affected, it's really important for the justice system, the communities that actually do the work in the justice system, to be able to communicate to their members in the General Assembly that this is something you need to fully fund. This is something you need to fully fund. And I don't know whether or not the term problem-solving court has fallen out of favor, and the pretrial has fallen out of favor, because if there's a policy to put people in prison, again, that's not the judiciary's lane. But what is our lane is to be effective at allocating scarce public safety resources. We understand we're operating in scarcity, and we need to be able to address these backlogs. So that's why I think Angie's looking at the right data to tell that story. But I really would envision a greater pool of money. I mean, I think that the money needs to be restored to when it was before we were making the cuts. And I really think that those ought to be categorized as public safety grants. I mean, I think that the communities through local JRAC, it should ideally be through local JRAC. I mean, this is the population of folks we're trying to work with would actually be awarded public safety grants based on our local need. We have the statutory means of collecting information through our annual reports. We have technical assistance through CEPP. We have certification teams that have been operating to look at problem-solving courts for a quarter century. So we have the ability to go out and help understand what the need is in a particular county and communicate that effectively to the General Assembly. And frankly, it would be a very efficient way to do it, because if you had some sort of certification, some sort of accountability, so that we were saying, hey, you're not throwing your money in a sieve, this is making a real difference, it would be a better use of those tax dollars. And to David's point, Judge's point, if that would put us in a situation where we're not penny wise, pound foolish, we would be spending money on the front end and ensure we have enough to effectively supervise and connect to treatment the folks that are, the behavioral health issues at the community level, and preserving that scarce public resource, safety resource, the prisons, for dangerous people that need to be removed from their community, because no doubt they're there. They come before us all the time. But I don't know. I mean, does that make sense that we would be looking at it more holistically? Does that make sense to you, Doug, or to? I really feel like we've been sort of talking past each other a lot of times when we're looking at things like pre-trial, looking at things like problem-solving courts, because I don't think anybody's conceptually, oh, this is terrible, but prosecutors have manpower issues when they go in. They can't try major felonies if they're having to go to a status hearing, and I get that, but we're operating with scarcity, and so I think that if we had the ability to really look at these communities holistically and figure out where the best target would be, that might be more effective. I don't know, does that sort of ring with you too, Courtney? So I mean, in my view, we ought to be talking as a collective whole, because this body was created in the midst of criminal justice reform because we were incarcerating too many people to sustain it financially, just to sustain it financially. And so when we reduced that population, it was important for all the stakeholders to come together in this legislatively created body to come up with some consensus about how to incarcerate fewer people safely. And lo and behold, I think that's really the mission now. It's really critical. But I think we can do that. But I think it is time for us, as we enter this next session, to really be unified in that message and make it happen. I mean, I know Brett Clark would want that to happen.
Yes. So I think you're preaching to the choir with me. I hope I've been at this table for a long time, even before I put this current hat on. And so this is bigger than a criminal justice lane issue, I think. This is going to have to be the holistic. I like that. I like the media approach to sort of win friends and favor, if you will, with our public, because this is an appropriations conversation, right? And every single group, as David can tell you, certainly Doug can tell you, all of the people here can tell you, every group has a compelling story. Every group says their issue is important. But when you try to go with the uphill battle of, I don't know, speaking on behalf of inmates, offenders, customers, clients, however you want to call those folks, it's an uphill thing, right? It's not always like public doesn't always just get on board and go, oh my goodness, yes, let's do what's in the best interest of the inmates or the offenders or the people who broke into my shed or whatever, right? And I'm not making light of that, because I've made those arguments for many years on their behalf in an effort to have better government. Because in the long run, it is exactly what you're saying. You can save more money if you do this correctly, right? It doesn't, in the moment, maybe it seems like you're being soft on crime or some other nonsense, but if you can still kick butt and do it appropriately with money, right? And I think that's where we need to go. But we need to have Mishler and those guys in the conversation, not just the Wendys and the Freemans and the Clarks and the Sturwalds, who are 100% with you.
Yeah.
But I think Senator Mishler and the monetary folks, Rep. Thompson, they need to hear these arguments. The public needs to be calling them, not just me or Courtney or somebody saying, hey guys, we really need the money. I think if the public did it, since this is long-term smarter for us as a state, maybe that would help.
So we're engaging in those conversations as well. But as we engage in those conversations, sort of my view of my role, of my court's role, I really think that we should be locally driven. I really think that, when I was a trial judge, most of my time was occupied figuring out how to get the resources I needed into my scarcely resourced community. And in this role, I really view my administrative duties as figuring out where those scarce resources are most needed and getting them there. And you're exactly right. The folks that are driving the fiscal policy are people we're communicating to. But part of that communication has to be, we need to keep a direct line to not only you as leaders of the constituencies that make up our criminal justice system, but also to have a sense of what your rank and file members need, because that's important. I don't want to tell them what Chris Goff needs. I don't want to tell them what Loretta Rush needs. I want to tell them what your local prosecutors need. I want to tell them what your chief probation officers need. I want to tell them what your community mental health directors need in order to keep people that don't need to be in prison out of prison, in order to keep people out of the state hospitals that don't need to be there because they're at capacity, and we need them for the folks that do need to be there. And it's just that simple. It's always just dealing with the scarcity issue, but it's complex because we do have this collaborative network of people that share the responsibility of connecting people to treatment, of supervising them effectively when they're not in those institutions. So I think we can get a lot done because I think everybody wants to do this. I think that the members want to be responsive to public safety needs. So that's really the drumbeat that I want to be going forward with. This is about public safety. And it is important for your members to know that. It is important for them to be in close contact. And doggone it, it is important for them to be participating in their local JRACs because we can really accelerate that communication if we have that. Tell them to invite their legislators to the local JRACs. Tell them to get them to know this because then when the fiscal people do, and they hear it from them too, that this is really a local need that they need to be responsive to, that also helps. You know, it's a very compressed legislative session with a lot of demands being put on people that this is something that they can understand. And yeah, I'm sorry that you all are in a difficult position too, but this is difficult work. But I am confident that together we can get through this season, and we can preserve public safety. We can do as much as we can with our scarce resources. So it's all hands on deck.
May I bring something to the table?
Please, Sheriff.
Sorry, we're having that feedback issue, so I apologize. Yesterday, we were at Marion County at the Sheriff's Legislative Roundtable, and something came up, and I wasn't really sure that it would impact this group until we started talking about the mental health capacity or component of this. And one thing that a lot of sheriffs are experiencing is the backlog of getting the incarcerated persons or the inmates, into IRDC. And there was a sheriff that mentioned yesterday that almost a third of his jail population is on hold, waiting to be picked up. And these are individuals that are going to need, mental health treatment and things like that. And this backlog is preventing that from occurring. I know we want to get the individuals that we can get out of the jail, get them that mental health help that they need. But these people that are sitting in jails waiting to be picked up, the jails, that's 18, 19-year-old jail officers that are, not mental health professionals. And, I'd like to put that on the radar too. And I think DOC is doing their best to get these individuals picked up. But if there's such a backlog at IRDC, I mean, can we have conversations somewhere where do we add on to that? Do we build a regional IRDC? And I'm not a correctional expert like DOC is. I'm just from the county perspective, that's what the sheriffs deal with. But that's also an issue that is plaguing the jails around the state that I think is preventing getting people the mental health services they need because they're sentenced at DOC. So that's just something I wanted to maybe have future conversations about. And the legislators were very receptive yesterday, and it's a good conversation to have. So I just wanted to bring that up.
Really important. Any other thoughts? Yeah, Joe, I'm sorry.
Yes, so I wanted to remind the group that about 4 sessions ago, we did pass for the state to look at a Medicaid waiver for incarcerated individuals to help with Medicaid coverage. Now, we have not done that, but we did pass for the state to to do that.
they are looking at it in the juvenile space through a waiver with CMS that my members are actually on a call with Medicaid now on. But I think that's a missing piece, right? And so to help with DOC and to help with the mental health stuff that the sheriff just alluded to, there's a huge gap in coverage for those that need it. And with the Medicaid changes coming into effect January 1st, we're only going to see increased uncompensated care. And so I think we need to add, it's not just a state budget issue, but there are Medicaid resources that we're missing out on with this waiver that we did pass that. It is in legislation. JRAC did a letter of support, and so we can't lose sight of what we've already done to continue to help maybe improve those services and those connections. So I just wanted to remind the group, yes, it's a state budget issue, but because we know what those limitations are, we need to look at other things like Medicaid and programs to be able to help in getting those services, because we're going to start feeling that pressure even more so with the level of uncompensated care that continues to, people continue to drop off coverage.
So I think that's a really important point. We had maybe a week or two ago now, Chris Naylor, Steve Luce, Commissioner Arnold, and I got to be part of a panel discussion with some of our executive branch agency heads, and that topic was brought up.
Great.
I also think that it's important to have a discussion about that in the context of our legislative work group, because I think that would probably build up some capacity that would allow some folks to look at other alternatives if they had that as an option. So I think that's an excellent point.
So, Justice, I apologize, but I want to just circle back to what Angela had mentioned. As far as this group as a whole, and these large cuts across the state, do we have a plan as a group moving forward? And is there a possibility of requesting emergency funding, or what are our options? Because this isn't new this year, right? These cuts started last year, and actually the year before that, there were significant cuts. So we're in year 2, 3 at this point of decreased funding, and I guess our association and our members are going to want to know, what are we doing as a whole? What's the state doing? What's the state JRAC doing? What are our local JRACs doing? And they're going to look to the state for those local JRACs to model. So as a group, what can we do?
Yeah. Well, the idea of asking for significant funding to address community supervision, community-based treatment, is something that I think needs to be part of legislation. The discussion we're going to have surrounding competency, I think, is a big important part of that. I think the discussions that are happening right now with the DOC, with folks that make fiscal policy in the General Assembly, are part of that. And I think probably our next meeting is scheduled for August.
That's 28.
Yeah. I think it would be realistic to come with perhaps a plan to vote on, and if there was the ability to come and present at least a sketch of what that legislation might look like, that might be a good way to do it. What I outline is really how I've been thinking about this, and it's hard to turn a ship on a dime, and it's irresponsible to do that too. So I think it's important to get buy-in around cost. I think it's important to get buy-in around prioritization. But I think sort of painting this as public safety, it makes it more palatable. It demonstrates and communicates the need for it. I think having built in some mechanism that the locals can demonstrate they're accountable for it, that helps the General Assembly know that this really is money well spent, and being able to come with some uniform data to demonstrate that it's actually good fiscal policy, I think is important. So, from my perspective, actually keep doing what you're doing. Keep keeping track of your members and the struggles that they're having, so that we can communicate them. but that's kind of what I see as the judge.
Just maybe to put some specifics in terms of what the timing concern is that Ashley has talked about. We're doing budgets now. I think you guys are probably doing them as well. We got budget hearings in August. Some counties have some project income that they can use to try and buffer things a little bit, but knowing is this a long-term issue? Is this a short-term issue? It's irresponsible to commit project income to something if it's going to be a long-term issue and you're going to blow through all of that and not have any kind of a buffer that county's been planning for years. If it's going to be a long-term cut in funding, it's going to be a short-term cut in funding, although maybe there's the ability to plan a little bit. It's going to be hardship regardless, but I think knowing what's out there and what the time frame looks like is going to be helpful to the locals to be able to plan, because you're at the point where you're making decisions about, do we let people go? Do we shrink our capacity? I mean, that's literally, those are the conversations that we're having locally.
I sent a letter requesting to speak with the folks doing the fiscal policy with General Assembly this week. Tried to coordinate it with several folks. So those are the discussions I'm trying to have right now. And I'm very much aware of the urgency. But if any of you have any input, you're welcome. If any of you have any thoughts or ideas, if we're missing something, no pride in ownership, but we're really trying to communicate, again, the urgency of what everyone is experiencing in as accurate way as possible so that we can get results as soon as possible. I will say, I wouldn't do anything that you don't absolutely have to do, because I think that the repercussions of that are dire. So we're going to ourselves, I think, do as much as we can to stopgap the problem. But our resources aren't infinite, certainly, and that discussion doesn't happen until later this week either. So I'm sorry I can't give you more details about that, Judge, but that's the urgent ask I'm going to make. We have that internally. Steve, yeah.
So not to pile on, but as a reminder, when we did sensing reform, we had two kinds of funding. The grants that we talked about today, but also the Recovery Works funding. And just a reminder for everybody, that was at the last budget as well, from $50 million to $25 million for the biennium. And the idea was, in those days, that as we figured out what we need to do in the criminal justice system, we would assign the treatment piece to Recovery Works, and then that would fund that piece, and we tried to work together with it. And I'll just say that I think that I understand why we're making a lot of the cuts. Totally get it. But as we do that, it will have a ripple effect. As we make cuts to Medicaid, it will have a ripple effect. And we're going to see a greater need for criminally and justice-involved behavioral health issues. And that's just a fact. And at some point, it becomes math. It's not even philosophical. And I think to the extent that JRAC can have, and I don't know where you want to go with the legislative committee and recommendations, but I think I don't want to speak for Senator Clark, but it's different when he goes and tries to say, I know this is important, but if he has a report and he says, I saw JRAC and they did math, and this actually would benefit the state as well as help people, but fiscally benefit the state, that's what Mishler would be responsive to, I would suggest.
Yeah. Yes. I mean, let's do that with this discussion, because this is, as I think you all know, this is all related. I mean, the backlog that DMHA is experiencing is very much similar to the problems that the DOC is having. Being able to explain at this intersection, behavioral health and criminal justice system is really complex. It's really an issue that needs to be addressed at the front end, or it's going to get unsustainably expensive at the back end. Is what we need to communicate. So we need you. We need you, our partner treatment, to do that. And I'd like to have that be part of our legislative recommendation as well. I think that both of these things can be addressed.
Great, thank you.
Can I ask, DOC, you guys there's a report that comes out every month, I believe, that gives capacity numbers, supervision numbers, all of those things.
Oh, the report that we do?
Uh-huh.
Okay.
Yeah,
yes.
yeah. Sorry.
I was just making
Our
sure.
report? Yes, that. Would it be possible to identify, even this coming year, the supervision numbers of the programs that were unfunded, and what that would potentially look like if those were moved to a local or a state facility? Would you guys be able to identify that number that we could then provide some kind of fiscal impact of what that might look like? Does that make sense what I'm trying to say?
I do have a survey that we circulated to every trial judge in the state after we received a preliminary letter, such as the one that this report's on.
Yeah.
And we asked something like, did you receive the letter? Is it representing a cut to your DOC grant from last year? If so, what do you expect that'll do in terms of additional placements in the DOC? And we had a really quick turnaround. We were trying to engage in these meetings to make this point. About half, I think, of the judges responded in 4 days. And I think it indicated that there would be about $90 million worth of additional DOC placements if those cuts went through.
Yeah.
So that's what we've shared. That's what I intend to share with the fiscal folks in the General Assembly. And that's when the DOC is at 90+% capacity, and the RDC is in such a backlog that there are counties with a third of their population waiting for replacement. I don't know how much more urgent that is, but that's what I intend to come and try and communicate. So I don't, there's always more that can be done, but that's what we're trying to do in a very short window to communicate why we think this is urgent.
I'm just thinking of that snapshot of every county and what they're serving. And so if we can identify last year, the pretrial that got cut, each of those, how many they were serving, that would be locally, right? But the problem solving courts we know specifically are more of a DOC commitment, or some of the community corrections would be, or those people that we could identify as being served in a snapshot of, hey, on this date, this is how many people in these programs were being served that weren't funded. Am I saying this right?
You are, and I think that's what the community doesn't know.
Yeah.
So you and I don't work in a feel-good agencies. Like, the community doesn't feel good when they talk about DOC and community corrections and probation. But they also aren't going to feel good if we can tell them and spell out locally in each county or community that, hey, we were doing this in this problem-solving court, and they were coming every week, and they had 3 drug screens a week, and now they're not in that anymore, and because of funding cuts, I think it would have to be stuck, because people don't know what we do unless you're in the system or work in the system or have family in the system.
I think mathematically, though, we could do it very simple, and I think that's what we have to do when we're speaking to the legislation, right? Is we have to make it simple, but we have to show those numbers. And so I'm saying, if we can say, okay, $20 million has been cut in 2 years from these programs, and within that $20 million, they were serving 1,100 people or whatever, and now those 1,100 people can't be served from that 20 million that was cut, and that 20 million would actually result in 90 million in a DOC bed. Do you see what I'm saying? Like, that math showing the difference of and I think this speaks to what Judge was saying. It was only costing us 20 million to serve those people. Now that that's gone, those same people are going to cost us the 90 million. And I want to know from our data that this is already out there, right? We've got all of this information. Is there a way to pull that information and make it as simple as that?
I'm not going to agree yes to that today because I do not know. I mean, we have a report that we generate that's generated for this committee and for budget that we are, by statute. But that stuff, I mean, we'd have to pull out through community corrections numbers. Right?
But we do have some of that data publicly available right now on our website. So you could see past numbers that we
Right.
have served,
Right.
and that we're not serving
Right now.
Well, we know level sixes that have a behavioral health issue that are in DSC.
Yeah.
Well, and when we did sensing reform, we initially didn't allow them to go to DSC. So I think it's reasonable to say, and last time I looked, that number was like 12 to 1,400, something like that.
Yeah.
So 12 to 1,400 people could be, but probably could be better served in a better and cheaper way than what we're doing.
But are those numbers, I almost think it's too, those are the same numbers that have been presented to legislation for decades. The same reports, the same, and I'm wondering if the media focused more on a micro level and then the community get to the legislation. It's a different approach than what I know our association has done in the past. In the past, it's been the president of Popeye goes and tries to testify and talk about the state as a whole.
I see what you mean. Yeah. Yeah. Yeah.
Mm-hmm. I just wanted to offer a possible solution in lieu of the conversation. Is it possible, Justice Goff, that maybe a couple of staff from our team could partner with some of the folks here to talk about what data they feel is important, collect that information, and then see if it's available and see what type of opportunities we have to help ensure that we're giving the right data and the right definitions and matching the right things versus us trying to do that here today.
Yes. I think that's exactly right, but I also think tie up with OCDO. And so that's what we are meeting about all of these things internally to try and do that, to try and put together a compelling fiscal picture that is accurate, and then a compelling message that allows people to understand much more concisely, this is really urgent, this is really important. And but yes, it should go deep. Somebody's making a really important financial decision on behalf of 7 million people. They need to have some data. I think most importantly, we're all looking at this. We're all in agreement. We have consensus. This is urgent. I think that we can make this a priority and communicate it pretty effectively. But in particular, Angela and Ashley, if you have a sense of what exactly needs to be included, and you, Liz, if we can sort of tell that story compellingly from the DOC's point of view, that might be really, really important for fiscal folks to be able to drill down on so that they can make a meaningful decision about what's really necessary. It's a great discussion. I'm sorry that things like this happen, but I am confident we can just address this. What else needs to be addressed today? Well, if there's no other business, let's go ahead and turn to member reports. Sheriff, we did hear from you a little bit about your discussion with some legislators and report on the RDC. Is there anything else that you'd like to share?
No, they're great meetings. We're doing that around the state as Sheriff Senator Clark. I still call him Sheriff. He's aware that those are great meetings that we have regionally. And we're wrapping up the last one, I think, on Tuesday down in Evansville. But they're very informative, useful. It's great having that relationship with the legislators where we can talk about different things that are happening. So it's good stuff. So that's all I have to offer.
Thanks for joining us. It's good to see you. Have a great weekend, Sheriff.
You as well.
You as well. Steve, anything to share?
I do not.
Zoe?
Yeah, so first I wanted to, with the sheriff still on and with the collaboration that has been taking place with our sheriff offices and our community mental health centers, that in May I had the opportunity to recognize Sheriff Noel Robinson as our Justice Advocate of the Year and his work, since you're going to be down that way. The work that has been taking place in Vanderburgh County is something
that we should all look at as a positive example of how mental health and justice can come together to see positive outcomes, both for the public safety and the well-being of Hoosiers. So really honored to present him with that. So wanted to share that with the group. And then also to thank Brittany and the Behavioral Health Committee. We had 3 judges at our conference in May to go over the report and then really to have an open conversation. Judges, providers, how can we make this work together and be helpful to one another? And so we're going to continue that great work. So thank you for your leadership there. And then speaking of our conference, even though we just had one in May, we have our summer one scheduled on July 9th. It is in Fort Wayne, so if anyone is interested, we will have DOC from a youth perspective sharing. It's very youth focused in the morning. We will have DCS because they are a phenomenal partner. For those of you who have not met Jennifer, the new director, I'm just absolutely thrilled with her appointment. So DCS will be there. And then, of course, our wonderful DMHA leader, Sarah Sailors, will also be there. You are all welcome as community stakeholders. You can register on the council's website, and we, Steve, and several others have been. It's a great day to connect with your community mental health and certified community behavioral health clinic. So join us in Fort Wayne that night. If you want to stay, we will be having a fun event that you can also learn on our website. It's a cornhole tournament and then also a pie in the face contest to raise some money for, so $100 to put a pie in my face. I don't know who would want to do that, but I'll do it for a good cause. So join us on Thursday, July 9th.
Thank you, Zoe. Good to see you. Doug, something to share?
Just that at our May meeting of our trustees, we approved $57 million in grants. A majority of that was our VOCA grant, which represents a 30% reduction in the amount of funds we received from the federal government. So that's about $20 million that we had less this cycle than the previous round of funding. So we worked really hard to ensure that there is statewide coverage of services for victims, but that's another area where we are seeing the funding from the federal government have an impact on service delivery.
Yours well. So thank you for being here, Doug. Thank you. Chris, anything else?
No, I think that's enough. Except Sheriff Fallon, we can reach out about. I'll have someone reach out. We can discuss what you were talking about, the jail holds. I don't know if it was a specific county or if it, but I'll have someone reach out for sure and discuss it with you.
Okay, sounds good. Thank you.
Angela, anything else you'd like to share?
We have our Popeye has their summer joint assembly with ICAC in August, and then our fall conference for the state in September.
Thank you. Thanks for your time. Catherine, anything from your office? Is there anything you'd like to share on behalf of the prosecutors?
Sure. I don't. Of course, I'm here for Chris Naylor, so I don't know what he's shared previously, and you should all be aware in your local communities, just having gotten past the primary election a little bit ago, but just as we're kind of talking about these conversations and what locals need and numbers and personal stories and drivers and things like that, this is the year that all prosecutors are up for election. So we will have between 27 and 33 new prosecutors getting sworn in at the beginning of the year, which makes it almost none of those people will have good stories heading into the next budget cycle, right? It really is drinking from a fire hose to become a new prosecutor because of the fact that you have to learn obviously what your relationships are with other stakeholders and in running an office and who all even works for you. Plus, most of our counties are rural, so prosecutors have caseloads that they've got to get up to speed on it, and individuals have trials set. So some of these conversations probably would be very useful if you're working on your local level to be having with the 27 to 33 who are about to leave. obviously the reason that's 2733, 6 of them are hoping they don't leave. But these types of questions, obviously we have a newly elected conference for the people who are coming in and the people who are staying that we have in December. So, but they learn a lot of new information at the same time. And some of it is about running an office and some of it is about how to do a trial. And, even though JRAC is included in that new information, just remind your members, you probably have a new prosecutor, and even if they're a deputy prosecutor or a chief deputy, it is still entirely different to be the person with the name on the door. I'll also say too, to echo those concerns about VOCA and things like that, prosecutors kind of find ourselves at the center of the Venn diagram of how these cuts affect everyone because most of our offices are funding their victim advocates with VOCA funds. Obviously, we are partners in the criminal justice system, and nobody's in a problem-solving court without the prosecutor having something there. So we have significant buy-in and make that decision. So, and then just like everyone else, we have staffing issues due to funding. So we do kind of find ourselves in the middle, and we'll kind of find ourselves being pulled different directions as it pertains to funding. But, happy to participate in these conversations. It probably requires, as everybody knows, a wholesale conversation about, what functions of government do taxpayers expect the state to fund, and I'm a taxpayer just like everybody else here, and I think education and public safety are the two things I don't question when the money's taken away from my paycheck, and so we would like to be able to participate in government paying attention to the criminal justice system and how much do you respect the actors involved.
We're really grateful to that and for the participation. I certainly hear the steady message of scarcity. It's something that we're all dealing with. Yeah. So I think that's really important to have buy-in with prosecutors. It is easy to politically support prosecutors because they do the critical work that they do. But it is important to have the buy-in because your ability to self-help everybody else understand that it's part of the system. And the system needs to be there in order for prosecutors to effectively do their job is something that I think can be easily missed. Yes. Especially at a time of scarcity. So we will be working to partner with you and your members. Thank you. David.
Yeah, thanks again for the ability to be here. We've been doing a lot of education with our members on, with Senate Enrollment Act 1 passing last year, and we've actually gone through property tax collections this year. So we're educating our members on what actually happened unit by unit from that perspective, and then also on the new income taxes. I think I mentioned this in the work group. Many of you know that counties have this special categories they can do for public safety or PSAP, and all those categories are going away going forward, and that all that funding will have to come out of what's called the county services rate. So we're educating our members on what it would look like going forward, and we've invested in a very interactive model so our members can go in and put in tax rates and see how much money is generated for the county, but also for the sub-county units. And so we've spent a lot of time on that issue, and just continuing to work on funding issues really. So.
Thank you, David. Always good to see you. Sarah, anything that you'd like to share with the group?
Sure, just a couple things. So, Senator, for your numbers, we have 98 competency or forensic patients waiting.
That's actually way better than I thought it was going to be.
Yeah. Okay.
Frankly.
We have 50 civil patients waiting for beds and 9 youth. So, current state today. July marks the 4-year anniversary of 988 becoming a 3-digit number. So we will be celebrating that, and our public dashboard will go live in July, mid-July, probably around the 14th, for the crisis continuum and being able to see the data that belongs to each of our 3 pillars within the crisis continuum. And then last week I had the privilege, honor of presenting the opioid settlement fund plan to the budget committee, which was passed. And so that portion of the plan is our 35% state abatement dollars. And so the plan includes $67.1 million worth of funding, which will be distributed for some local match opportunities, which includes $2 million, $20.4 million for treatment services, $20.6 million for prevention efforts, $15 million for recovery services, $5 million for enforcement and justice system initiatives, and then $3.1 million for workforce and employers. And then there's $1 million that's set aside for reporting the annual report that gets done. That's it.
Well, Sarah, we're so grateful that you're here as a principal of your agency. It's so nice that you're here. We're working with you. So thank you for your report. Thanks for your participation. Chris.
All right. From my report, I'll just talk about YJOC. I also staff YJOC. We met in June. I will step back. YJOC being Youth Justice Oversight Committee. So I'm the guy that's going to talk a little bit about juveniles. At the last meeting, members were asked to identify their top 3 priorities. It's not surprising that they look very much like what the local JRAC's report, aside from some different language, but it is data, funding, behavioral health, and then, as I talked about at a previous meeting, the detention bed space or capacity issue that the locals are dealing with a significant amount of them traveling 250 plus miles to find a bed for a youth that needs secure detention. That's it for me. To you, actually.
Thank you. ICAC, as I previously mentioned, will be holding our summer assembly August 20th and 21st. It will be at this meeting that we all the leaders across the state and community supervision kind of collaboratively work together to try and approach these huge budget cuts and discuss current strategies and future plans on how to advocate and support for our members and agencies. I think from this meeting, our goal will be to discuss the data that is going to be needed for the legislation, those numbers, start having those conversations with DOC as well, seeing what we can get together so that we can present something as a whole. I think that's going to be our main strategy at our summer assembly. Outside of that, we're just going to hopefully try and support our agencies and our members as we kind of approach this next year. So that's all from ICAC.
Okay, IJA, we've got a retreat coming up in July. We're going to be talking about some of the big issues that we've talked about here today, and so those are some of the things that we're concerned with. I think Courtney's comments resonated with me. We got some new judges that are coming as well. I remember distinctly when I took the bench 20 years ago in January, thought I was just going to be sitting in my Eiffel Tower making decisions. There's a whole heck of a lot more to judging.
For the small business.
Yeah, oh my gosh. So we've got quite a few new judges that are coming online as well, and so we'll be talking about JRAC and all of the stuff that judging involves, but interesting to see how that goes too.
Well, I would agree, Courtney and Judge both. We're going to have just under 50 new sheriffs coming in as well. So everybody's going to be kind of going through all this together in our various counties. And I think the third tier of that would be roads and bridges. If I'm going to talk about the 3 tiers of what people expect from us, is just what you said. And put roads and bridges there, and I think you got it. Steve, exactly right. Give me some ammo to go into this battle with. I can't just go in there with the handout because everybody just goes up with their hand cup like this to Senator Mishler. And he does a fantastic job, but I don't envy it because it's very hard. Everybody at the table wants him to give them money, and he does remind me of that often when I go begging. So that is always interesting. And then 988, I'm having a meeting in July with some of the folks at the 911 side of that going, and our state treasurer, I think, perhaps is going to show up there to sort of talk more about bridging the gap between those and how that looks. I brought it up at this meeting before. My 911 director in Hendricks County is very passionate about this and feels like there's something missing in the communication between those two entities, and I would agree a little bit. I think we need to talk about it.
Yep.
So please include me in some of that if it's possible.
Okay.
And I did text the sheriff. I'm just going to be open with the group. It's more fun to be the sheriff at this meeting than it is the legislative. I was shocked. Thank you.
Funny.
I didn't argue with.
That's funny.
Thank you very much, everyone. It's a difficult time, but I do look forward to working with all of you on this to try and address it, try to mitigate some of these issues as best we can. If something comes up between now and then, please reach out. Already scheduled to be in contact with most of you. So, and our next meeting scheduled August 28th, 2026 in this same location. So see you all then. Thank you.